and a very good morning to all of you. If you're just joining us, you're very welcome to day 2 of ESCAIDE 2021, which of course is being held entirely online for the second year due to the pandemic. I'm Karen Coleman. If you haven't met me virtually before, I'm a journalist and a broadcaster from Ireland, and I'm facilitating this year's conference. So now it's time for the first plenary of today. It's plenary session B, and it's on modelling epidemics in real time, a coming of age. So mathematical models developed during the coronavirus pandemic have been instrumental in understanding the spread and the impact of the virus and informing policy decisions. And so this session will look at the innovations and impact of modelling during the pandemic so far. We will explore what could have been done better and how modelling could be better translated into public health in the future. This session will be chaired by 3 members of the ESCAIDE Scientific Committee. They are Bruno, Coignard, a medical epidemiologist specialising in the epidemiology of healthcare-associated infections, HAI, and antimicrobial resistance, AMR. He is currently the director of the Department for Infectious Diseases at Santé publique in France. The second chair is Magdalena Rosińska, a researcher and public health specialist for blood-borne and sexually transmitted infections. She is a professor at the National Institute of Public Health, National Institute of Hygiene, NIPH-NIH in Poland. And our final chair for this session is Adam Roth, medical doctor specialising in clinical bacteriology and virology and an associate professor with a PhD in epidemiology. He is the head of the leadership programme health training at the European Centre for Disease Prevention and Control, the ECDC. Chairs, you are all very welcome, and I will hand over to you now.
Hello, good morning, everybody. Good afternoon or good day, depending on your time. And welcome to this plenary session of ESCAIDE on modelling, as Karen just introduced. So this is really an exciting time for modelling, as it was used extensively during the COVID epidemic. And we will look today in depth a little bit on the use, the challenges, of course, as well, and also how modelling improved during this pandemic. So to introduce you to the session, we are going to center around 3 themes, and we will have short presentations from our panelists, after which we will have time for discussion. So the first theme that we are going to talk about today is about the contribution of modelling to understanding of the epidemiology of the disease, and maybe a little bit to get a glimpse into the future with the forecasts. Then we'll move to the theme around interface between data generation, management, and modeling, and what kind of challenges we can expect there and how to overcome those. So, of course, good modeling comes with good data. And finally, our third theme is around communicating the results from modeling in order to use them for policy making. So that's very important, especially in emergency situations, such as we faced these couple past years. So with this, I would like to pass to Bruno to introduce our really distinguished speakers for today. Thank you.
Thank you, Magda, and welcome to you all for this plenary dedicated to modeling epidemics in real time. So we are very excited as we have an impressive panel with 3 distinguished speakers. Each of them has a very long and remarkable experience in modeling, and they have been very active in using this knowledge for advising governments, public health agencies, or international authorities during the COVID-19 pandemic. So we are pleased to welcome Vittoria Colizza, who is head of research at INSERM and Sorbonne Université in Paris, France, since 2011. We also thank and welcome Neil Hens, who is holder of the chair of evidence-based vaccinology at the University of Antwerp in Belgium since 2009. And last, we thank and welcome Jaakko Wallinga, who heads the Unit for Infectious Disease Modeling at RIVM and holds the chair in Mathematical Modeling of Infectious Disease at the Leiden University Medical Center. And Jaakko will be the first speaker, and Adam, the floor is yours to introduce the session.
Thank you very much, Bruno. So before we start with Jaakko's presentation, I'd just like to say that this session will be a session between you, the audience, and our three speakers. So we as moderators will just try to pick up whatever questions you have. So please start putting them as soon as you can into the live chat box, and we will pick them up and try to attend to them and bring them into the discussion as much as we can. So the theme of today, real-time modeling, it's not by any means new. It's been used and it's been instrumental in helping us counter communicable disease threats for a long while. Both in terms of predicting what the risk for importation is and the risk for spread, and also to evaluate and choose between intervention measures. And I think this is what we're trying to convey today, is really how COVID-19 now has changed this, and how this will be developing due to COVID-19. And it's really, as Magda and Bruno said, really fantastic to have this our speakers here to share their experience on this. So first of all, then, Professor Jaakko Wallinga will share his great experiences on this, and I think we're all aware of what strain and what pressure must have been on modelers all over the world now. Suddenly you in TV chairs and speaking to populations. Sometimes, or other times you've had more or less a direct line to the Prime Minister and deciding on huge things such as lockdowns, etc. So I'll be really happy to, I'm now happy to introduce Jaakko Wallinga to speak to us and share his experiences with this work. Please.
Well, thanks, Adam, for this introduction, and thanks for the opportunity to speak here about our experiences. Like the title of this presentation is Real-Time Modeling of the COVID-19 Pandemic, and it's of course a bit centered on our experiences. And when I talk about we or our, I mean the COVID-19 modeling team of the RIVM, that's the Public Health Institute in the Netherlands. Next slide, please. Just to give you an idea of what we used to do, there's a picture of the team like discussing scientific papers. We used to focus just on modeling spread and control of infectious diseases, mainly developing methods to assist in controlling emerging epidemics and outbreaks, just kind of preparing for things that might come. Little did we know back then, and assessing the costs and effects of infectious disease control. And mostly that boils down to evaluation of vaccination programs. So that's what we used to do. And next slide. Then 2020 started, and we found ourselves just in the middle of like a completely new situation, where we had to learn very fast about a new infection and what it meant. And on the left, you see a copy from an article in the journal Science, where that basically says that we made a forecast that an intervention should go right, and if it doesn't, well, I mean, we never knew what would have happened then. So there was a lot of pressure on us in a situation where we didn't know much about a new emerging disease. So what we did technically is, like, we learned from incoming data. It's what I call a kind of statistical learning. I'll talk a little bit more about it later on. And we were conducting lots of scenario analysis and making projections of what could happen. We were very busy informing the relevant platforms for decision making. As was said in the introduction, like we suddenly like found that like our results really mattered to decision making. And yeah, we had to explain our results to a lot of people. We also had to explain our work to the media and to the general public, because everybody wants to know why they have to go into a lockdown or take unprecedented measures. So all this came with an unprecedented level of attention and pressure on each of us. And to be specific about our role in the decision process in the Netherlands, is basically there's a lot of data coming in. That's where our colleagues come in to look after that. Then we come in analyzing a lot of these data streams, bringing them together and doing the modeling and making projections. We present this in, like in the Netherlands, there's an outbreak management team. That's a kind of platform for decision making, or a health council, and they technically inform policy decisions. So it's good to know that policy decisions are not only informed by modeling, but always together with expertise from virologists, epidemiologists, microbiologists, and so on. And also like other considerations are taken into account. And of course, the thing I would like to stress is that we don't do this work just by ourselves, but always in collaboration with partners like other public health institutes and other academic institutions. And we collaborate within others in EU projects through WHO and through the ECDC. The next slide, please. Like this is what I mean with statistical learning from incoming data. There's a graph on the left that shows like epidemic curves for the number of notifications over time in the Netherlands, for the number of hospitalizations and number of deaths, and that's the kind of data that we collect. So we record number and timing of events on symptom onset, on positive tests, hospital admissions, ICU admissions, deaths. We also collect sequences of selected samples, so we know the type of the variant of the virus. We collect information on who infected whom. We ask people like who infected them. We extract information from hospital data on the duration of stay in hospitals. For the patients, we integrate all the information we obtain on vaccinations, like who got the vaccine, which type of vaccine, how many shots, and like we try to estimate what the efficacy is against infection, transmission, and severe illness. And we're also collecting information on the population behavior. Like we ask to a selected panel, like how many others they contact and about the settings in which contact occurs. We collect data on mobility of people, and we also ask about payments that people make, card payments in stores to see where they are. And so there's a lot of data coming in, and that's, I think, really new in the COVID-19 situation, that there's a lot of different data streams. Next slide, please. Then, like we also like have to answer questions, of course. We don't only collect the information. So the kind of questions that come up, they change all the time. And so the question that comes up like now or more recently in the past month is, for example, should we vaccinate the 5 to 11-year-olds against COVID? And these questions keep on changing. There are lots of unanticipated events. For example, the emergence of new variants, like in December last year and in June of this year. Basically, we have to start all over again with estimating all the characteristics of a new virus. And of course, there are changing circumstances. There's a different willingness to follow rules and guidelines over time. People are getting tired of measures, and we have to deal with that. And basically, on the right, I try to illustrate how this works. Basically, all the time we kind of construct or revise the model, and we try to integrate new data streams when they become available, using the model as a platform. Then we fit the model to the available observations, and based on that, we make a prediction of what might happen. And then later on, we confront these predictions with the observations we have and see if there's a need to revise the model, and if there's a need to include data streams. So in doing so, we answer the questions using this iterative and adaptive strategy to learn. And I think this is basically the heart of real-time modeling. is that you use data as they come in, and all the time you check if the model is doing well and if it's answering questions and if there's a need to change and update the model. And in doing so, we try to reduce the uncertainty, like first of all by combining multiple data streams about notifications, but also about the different variants that are out there. And if necessary, we try to reduce uncertainty further by collecting different kinds of data. For example, data on mobility or on contact patterns. And of course, we have to acknowledge the remaining unknowns and their consequences throughout. And all this requires a very flexible model. Next slide, please. Then real-time modeling can take various forms. First of all, there's something that we call tracking. Different people might use slightly different terms, but by tracking, we mean like basically estimating variables based on incoming data. And like here, I try to include an example of data we have on the COVID epidemic in the Netherlands. On the top figure, you see the number of notified cases that test positive by symptom onset date, and we color them by the different variants. So we see the original strain is in blue, the alpha strain is in cyan, and the delta strain is in green. And based on these incoming data, we estimate the reproduction number. So that's the number of secondary infections per primary infection, and that's on the bottom figure. So a value of 1 indicates that the epidemic is in a stable situation. Below 1, the number of notifications will decline, and above 1, it will increase. And we see here that the blue line is the reproduction numbers we estimated while we were dealing with the original virus. So we were doing quite well for a long time, but then came the new alpha variant, and you can see the entire curve shifting upward a little bit. That's the cyan curve. And then when we were doing well on that one, then the Delta virus came along, and there we look at the green curve. So by using this kind of method of tracking the reproduction number, we can see retrospectively how well we were doing based on all the incoming data on number of positive cases in the Netherlands. Next slide, please. Then we also use Nowcasting, and Nowcasting basically is estimating something that is like happening in the present, but we have not observed it yet, for example, because there's reporting delay. So one example of that was that we tried to estimate how many infections were caused by a new variant. So this slide shows a picture of a situation on July 1st this year, when the Delta variant was taking over from the Alpha variant in the Netherlands. And the data we have is based on samples that were taken, and we have the sample date on the horizontal axis here. And it takes a little time before a sample is collected and sequenced, and all the information is collected in the Netherlands. And based on that, we try to project like the current proportion of variants in the infections. And the green line here indicates the proportion due to the Delta variant, and the red line the proportion due to the Alpha variant in the Netherlands. And we also like make a forecast of that when projected into the future. So basically, this is an example of nowcasting when we want to know like how many infections are caused by a new variant right now. And so this has been very useful as well. Next slide, please. Another example is forecasting. And of course, this is what a lot of people are thinking about. But there are different kinds of forecasting as well. Like the example I showed here is forecasts of the number of new ICU admissions per day in the Netherlands. The observations are black dots in the graph. Like on the horizontal axis, there's time. On the vertical axis, the number of new admissions per day. And then the curves that are fitted through it are like modeled incidence of new ICU admissions per day. And the red line represents the model fit. here. So this is what we fit, and we can project it a little bit into the future. That's what you see on the right-hand side. And then the kind of pink band around the red line that indicates the uncertainty we have in our prediction. And this is recent data. The simulations are done on November 10th, so just a week ago. So this is basically a projection into the future, like what would happen if all measures would remain the same. And of course, it's easy to check how well this projection works out. Like we just wait a week and then we can check it against new observations. What we also do, what's useful, is calculate counterfactuals, like what would have happened if we would have taken different measures in the past. So for the past changes in the Netherlands, like we also look what would have happened if we did not relax the measures. And for example, like one of the measures we relaxed in June, if we didn't relax it, we calculate that the number of ICU admissions would have followed the green line in the curve. And later on, we relaxed measures again, or a little bit, and that's indicated by the blue line here. And the validity of these projections of these counterfactual calculations can be checked by basically extrapolating the accuracy of the projections we have. What we also do is scenario analysis. They're not indicated in this graph, but of course, like we can calculate like what would happen if measures would change in the future. And the only way to check if that's accurate is to have an adequate causal structure of the model, that we know the interventions are modeled right. And that's just because we cannot do a controlled experiment where, say, one country is subjected to new measures and the other kind of clone of the country would not be subjected to it. We don't have these observations. We can only see one outcome for one policy decision for a country. So basically, that's what we do with the models. And then next slide shows basically what we are learning then. As the data are coming in and we are modeling and like week by week in real time, we learn lots of things. For example, during the past year, we learned about the seasonality of the virus, like what percentage of the what percentage increase of the reproduction we could expect in winter, and what percentage of reduction of transmissibility we could expect in summer. We've seen some surprising outcomes where we thought like the model must be wrong, but like we couldn't find anything, so we presented it anyway, and it turned out to be a correct prediction of what would happen. And most of this was like a prediction of an upswing, and we, that is the modeling team and other experts, didn't see this coming, but through our modeling exercises we could detect it. And later on, it turned out that basically the reason why the model can detect it is that it combines different information streams. And I think we humans are not as good at that as models can be. But of course, sometimes outcomes are just not correct. And I think it's very good to always keep an eye out on what a specific transmission model cannot do. For example, in the transmission model we use and many other teams are using, we assume homogeneous mixing within age groups at a certain level. So the model cannot predict what will happen at a very fine grain, like, for example, what happens in a specific neighborhood. Like, if you want to know that, you have to use a different model. It's always good to keep an eye out for these blind spots. Then I would like to talk a little bit about communicating all these aspects of the system dynamics, the risks and uncertainties. Like what we learned during the COVID pandemic is that it's very important to specify when you talk about a number of modeled ICU admissions, like what you're talking about. It could be like an estimate based on actual data. That's what I showed you earlier as the tracking example. It could be a nowcast. It's based on available data that there is, but you could, in principle, like check it within 1 or 2 days. Or it could be a forecast, like something that can only be checked much later on. So we have to be very specific, like what it is, what a number is. These numbers have different meanings, and they sound just like very similar to the general public. We also found out that when we talk to policymakers, that it's of course very common to have confidentiality statements. When we talk to the general public, it's very important to respect the privacy of all the personal data that we are dealing with. And when we talk to our colleagues, scientific colleagues, open science is the norm, and in a time of crisis, timeliness is essential. What we found out that there's an expectation that we provide regular updates of ongoing work. That's very timely. It should be open to everybody. It should respect privacy, and it should be confidential. And we find that this is kind of uncharted territory, but of course it's unrealistic that somebody can do all of this at the same time. And finally, I would like to acknowledge that all of this work that I presented is not something that I've done by myself. It's really teamwork that's crucial. So here are all the team members that have contributed to this. So thank you for your attention. And over to the organizers.
Thank you very much, Jacco, for that great presentation. So we have a few questions that have come in the chat, and please, all of you, enter questions. And even though we may not have time to deal with them now, we will perhaps be able to pick them up later on in the presentations. So we're running a bit tight on the schedule, but Victoria and Neil, could you just pick out one? What's been a major real innovation in terms of real-time modeling that you think have big implications for the future, just with a sentence or two?
Yeah, thank you. Happy to comment on this one. I think the major innovation here is the use of that many data streams that are available right now, and to balance all these data streams all together to integrate them into a mathematical model. That for me is one major step we've taken.
Thank you, Neil. Victoria, any comment there also?
I would totally agree, and I think I'm sure Neil is going to present about the innovation in the data. And it's not only data. We really need to remember that data in order to provide information needs to be properly integrated. So there is also the flexibility of the approaches that goes along with the data availability.
Thank you very much. So there's one question that I'd like to bring to you, Jacco, before handing over from the chat, and that is that the quality of models have varied quite a lot. And in these times when we have rapid publications and unpeer-reviewed publication, preprint, etc., how can we, and even like input from people on social media, anyone can be an epidemiologist these days. So how can we separate litter from wheat? Do you have any tips to give?
Well, I think the most important thing is to realize that you have to do that right now, and also I think like in normal times you would trust peer-reviewed publications, but I think also it's very hard to find good reviewers for that. So I think like what I do is also to look at the track record of the authors of any kind of tweet or a publication or preprint. And that doesn't mean that anybody who doesn't have a track record is not any good, but I think you should be a little bit more careful. And I think also like check if other teams are coming up with the same answer, because I think many different teams are very active and addressing almost the same questions. So I think it's always good to check if you are dealing with an opinion that's really an outlier or whether there's kind of consensus about it. That's my recommendation here.
Thank you very much. So handing over to you now, Magda, for the next presentation.
Okay, thank you very much, Adam. So we already touched on the issue of data and how important it was these days. And I think we'll continue now with a presentation from Professor Neil Hans from Antwerp University, and he will tell us more about how to use the data, how to integrate them, and what challenges you can encounter, and how to collaborate best with the people who actually generate data and run epidemiological studies. So please, Neil, the floor is yours.
Okay, thank you very much, Magda. thanks a lot for the invitation as well to share some insights that we gathered during this pandemic. So this is, of course, I will start with my acknowledgements to the whole group, which is based in Hasselt and Antwerp. And from that consortium, the CIMMIT consortium, we also participate in different European projects. And there are a lot of people that contributed to this directly and indirectly, which I think is important. And I've also posted a few websites that you can actually access on use of some of the data, initiatives for standardization and so on of different data sources. But let me start with giving more background. Next slide, please. So, of course, I'm not going to go and linger on kind of the past and going back to introduce the history of mathematical modeling, but nevertheless, some of the things that we're discussing today are not very novel, let's say. Some of the discussions we're having have been held in the past, and I think what I sometimes see missing too is people knowledgeable about what people have done in the past in this field, because a lot of these discussions have been taking place, and of course not always answers were given to those discussions. But I think we learn from what happened there, and we can apply it to what we are dealing with today. I'm also sharing the picture from the book by Matt Keeling and Pesh Rouhani, and of course there are different versions related to this picture. It presents the natural history of a pathogen in general, kind of a default picture. What I think is important to say is that if we look at the infection status of people crossing the susceptible stage, then going to be exposed to infections, but they're not yet infectious, then after they become infectious and then hopefully they indeed recover or they are removed from the population when they die, that is something that we can model fairly well, mathematically speaking. Some of these models are pretty complex, but nevertheless, I think we have a hands on how to do that. It's really the integration with the medical status, the data that we have and so on, that makes the models useful. And in that sense, although I do not like to make that divide, I always try to do this to actually make clear that we're dealing with mathematics and statistics at the same time. And some of the modeling that we do are really integrating both, because we want to, at the same time, deal with all the uncertainty, the complexities of the data that we're observing. But we also want to back it up basically with a mechanistic model that actually tells us a bit more of how disease transmission is really taking place. And that I think is very important. Mathematical epidemiology is about understanding disease transmission. And each time when we learn new things, we improve our understanding. And then we can turn that into, for instance, indeed, as Jaco explained already, forecasting scenarios. A model as such is therefore always a trade-off between accuracy, transparency, and flexibility. And many of us who develop models actually at some point in time also had to think about computational complexity of a model and how to actually adapt it. What I think is very important indeed is that these models are data-driven, and I'm now showing two books which I like very much. Honestly, one, of course, the disclaimer is I'm a co-editor on that book, but I think the book by Niels Becker in 1989 is a very good one. Also pointing out already the value of data and what to do with these data. And then last year, well, in 2019, actually, we published a book with many contributions of people around the globe on how nowadays different data sources can be used to inform our modeling. And I think that's what we're using today. It's really data-driven. There are many data sources that we can use in our modeling. But at the same time, I would like to stress the importance of validation. And this is also one of the key elements that I've seen people not always doing that. And Jaco's schedule, that schematic that he presented just a moment ago, is very clear on that. If we are developing models, we need to actually do that iterative process of validating what we've done each time again, learning from the validation process, and improving our modeling each time again. I think that is a key ingredient here, what we learned throughout this pandemic as well. Next slide, please. Data-driven, what does that mean? Well, Jaco already indicated that there are a lot of different data sources. A lot of countries have confirmed cases, and these have been used as a comparison type of data streams, different time series. Think about the different initiatives that were there to collect confirmed cases data from different countries worldwide. The important bit there is, however, that the confirmed cases as such, they arise from a certain collection mechanism, a surveillance system, and you need to know the ins and outs of that surveillance system to really know whether they are comparable or not. I think that's one of the key issues, and I'll come back to that as well for hospitalizations, and that's how do you count the COVID deaths, for instance? What is a COVID death? What is the definition, and so on. We also looked at many other data streams and so on. I will not handle them one by one now, but I tried to make an overview, next slide please, of different data streams that are needed in different phases of this epidemic. And of course, if you try to do a classification, you always have problems of classifying things in the right box, let's say. And take it with a grain of salt here as well, because a lot of the data sources that we use in different stages of the epidemic are also useful in another stage, of course. But I would like to divide the phases of an epidemic in 5 parts. An invasion, when you really get outbreaks, the first outbreaks that occur. Then you get more cases, and you see basically an exponential growth pattern. And then you're intervening. You're intervening by doing lockdowns or different measures and so on, and then you're playing or you're taking the dance, let's say, with relaxing and strengthening measures all along to keep it under control. And hopefully, finally, you can keep it under control. You've learned enough from the data that you actually can make sense of how to keep it under control for a longer time, and eventually return to endemicity. In these different phases, we use different models, and I've just listed one example each time of what we can do in terms of methodology and modeling. But what is also important, I think, is that we have to have the right data to inform these different stages. And so one of the things that we learned, I think, is that we need really good data on transmission chains at the early stages of an epidemic. Of course, also at the further stages, but I think this has been not always well developed in the different countries worldwide, and this is a lesson to be learned, that we need to construct basically a framework where this can be done, where data can be gathered, where data are comparable over different countries, and so on. If we think about exponential growth, of course, we are dealing with incidence data, but this is also related to diagnostic testing strategies, identification of symptomatic versus asymptomatic infection, and so on. It's quite complicated in its own right. But that is kind of the first data you want to get a handle on. And then if you play the dance, of course, you need more data. You need genomic data. Are variants popping up, and are they changing basically the control of the pandemic? One thing that I haven't seen as much as I would have liked to is serological data. Serological data, although it's not perfect, and it's not the best marker of immunity, it sheds light on immunity and how the circulation of a virus in a population actually takes place. And then, of course, mobility and social contact data, and we've taken some initiatives within the EpiPost consortium related to that. In terms of control, when we're talking about control, I think we need to focus as well as on risk groups. We need risk group specific data more and more. And then, of course, we also need very good vaccination data, and that is related to coverage, but it's also related to vaccine efficacy and effectiveness against transmission, against disease, severe disease, hospitalization, and death. If we talk about endemicity, I think we need continuous surveillance data, Cohort-specific studies are very important there to monitor immunity and monitor, for instance, whether immunity wanes or not and to what extent this actually takes place. In terms of the management and policy, I want to make that link a little bit here because I think it's really important. We've seen a lot of debate about whether this was a flu-like disease or not and so on in the early stages of the pandemic. I think it's really therefore it's really important to characterize the disease as soon as possible. And one of the key features of SARS-CoV-2, as opposed to other coronaviruses, for instance, or other viruses as a whole, is the ability to transmit before symptoms appear. And this is tremendously important. And of course, this actually, for the management, also translates into which intervention strategies need to be taken. What is also important then is that you need good hospital data, mortality data to assess what the burden is. What is an acceptable burden, for instance? These are discussions that should be fueled by data as well, and hasn't been very easy at all, also because in different countries, different international studies have used different definitions of these type of data, or their healthcare system is not comparable at all. And then data on perception, adherence, mental health is crucial, especially when you're doing the dance, when you try to control this, to inform the public on what is happening really, how is the public dealing with these intervention measures, and what are the smarter strategies actually to keep it under control. I think what we've also learned in the control stage, and I think earlier on, of course, this is also very useful, is, for instance, to use different early warning indicators. We can use a lot of data that is out there. I think particularly on sewage data, for instance, that was really something that before this pandemic was perceived as being a good idea, but we've seen really people making progress in this. So that sewage data is really actually a very valuable source of data as early warning indicators. And moving towards endemicity, and I think we're not yet there, of course, but we're moving towards that area. I think more and more multi-pathogen data will become important. This is, of course, not a complete picture, and there are a lot of things that can be added to this, but I try to at least try to sum it all up here, and for the discussions, we'll actually make such a diagram and a schedule like this much better. Next slide, please. I would like to add some considerations here. We're using different data streams, and often enough, when we're having these discussions on how to manage this pandemic, some people say you have to look at this and you have to look at that, and only the hospitalizations are important, or only the cases are important, or the positivity rate is important, and so on. I think I would like to stress that the different data streams, whether related to transmission or whether related to the burden, should all be used together. It's not one or the other, it's all together that actually presents a full picture. And mathematical modeling can really be seen as an integration of all these data, although that's not so easy. And also mathematical modeling relies on assumptions, and these assumptions should be made very clear. And that is also not always easily done because of the many tasks at hand, let's say, for all those involved in management of this pandemic. What I think is investigated, maybe underused at this point in time, is mathematical modeling can also be used to design infectious disease studies. So we can really use it to identify which are the data sources we need most to get a better performance out of our models. And then in terms of real-time data, we need more surveillance systems in place, including contact tracing. A lot of countries have stepped up there in terms of contact tracing, but it took a lot of time to get going. And I think this is work that needs to be done in peacetime, of course, with a functional and flexible type of framework that should be developed and hopefully also standardized in some way over many countries, over the different countries. Next slide, please. So, and that brings me, of course, to international comparison. Standardization is often difficult, and nevertheless, I think we should be really clear about that this is tremendously important. We want to learn from each other. And we learned a lot by discussing with colleagues internationally, not always about specific quantitative items, but rather about the principles, the qualitative assessment of how this pandemic is evolving. One key important thing is we need data dictionaries to be aligned much more, if possible at least. And sometimes this will not be the solution because hospital capacity is measured in different ways in different countries. For instance, because the healthcare system is organized differently. What I think is also lacking is population-based surveys rather than convenience-based surveys. We've set up a few convenience-based surveys because we had no population-based survey at hand. And there, I think we really need to work on this in peacetime. And I think there are some countries with really nice examples of how this could work. And we learned a lot from what they've done actually during this pandemic. And then I already stressed it that the design of studies is important. I think this should receive much more attention. For instance, longitudinal survey data. There are downsides to that. There are disadvantages as bias that is appearing because of fatigue, for instance, people not living up to filling in the diary or the questions each time again in the best way possible. So we need to develop systems to also quantify that bias maybe, or to get an assessment of that bias. Next slide, please. I just want to give one example that we've been working on with many colleagues, and this is under the lead of the London School of Hygiene and Tropical Medicine. There's a work package within the EPIPOST consortium, and this has now been translated. This was a complex study during this pandemic that has been conducted in the UK, in the Netherlands, and in Belgium, but then expanded to many different countries, in total 20 countries. And these data have been made available to people. People can use these data for their own models and so on. And I think this is one of the efforts that I think has been really worthwhile. But this is not something that started during this pandemic. We started doing this before the pandemic, gathering different social contact data from around the globe. And I think this is one of these efforts that we actually should maintain for the future. These contact data have been, at least in my opinion, really useful to follow this pandemic. Of course, there are always issues with any data source you're using, so you have to be careful, but at the same time, this has been a tremendous effort by different people all around Europe and beyond as well. Next slide, please. In the interest of time and to allow some discussion, I'm going to be short on this one, but this is another diagram that you can actually use. And this is a diagram that we constructed within the Data Science Institute at Hasselt University in Belgium. And I would like to stress that this is also a cycle that I think is really important, that the contextualization of the data that we are collecting. What are the ins and outs? How are the data being collected? How do you manage them in the best way possible? And then indeed model, explore, evaluate model performance and so on. And then deploy, understand, or disseminate. You want your users, basically policymakers, you want them to get a hand on what is happening here. And I think we made progress there, at least from personal experience, I can say we made progress, but there is still progress to be made. And once you have that cycle, basically, you can go back to what are the data sources or the contextualization that we need to invest in more and so on. So what I've also noticed is that we had to encounter a lot of obstacles, and we had to overcome a lot of obstacles when data collection is concerned. A lot of people, and I've witnessed both, people looking at obstacles more than at solving the problem. I think we all are problem solvers here, and that's the stand we really need to take. And therefore, I would like to have a look at the discussion on the next slide as well, because I think we need to learn from this crisis. So next slide, please. So this is my final slide. I think in hindsight, and of course in hindsight you can criticize a lot, but I think I would first like to stress that we made a lot of progress during this pandemic. But of course, we also are here to look back and to be quite critical about what are the things to improve upon. And I think good contact tracing data is something that we're lacking. There are countries with an example of really doing this in an exemplary fashion. And I think we need to learn from that. We need existing surveillance systems that are up and running basically when a pandemic is really there or a threat is really there, that we can basically activate them or take them at a higher level again. And then the population-based surveys panels that we can question that have been set up before the pandemic. And that's useful for a lot of different things that we would like to do. And then two things that I still want to address. Open data, open science are key, I think, according to the FAIR principles. So findable, accessible, interoperable, and reusable. And I don't think that's in contradiction with privacy issues and GDPR, but I think we need to discuss that much more. And these discussions will really need to take place in peacetime. And with this, I would like to end. I would like to thank you for your attention, and maybe just the collaborators on the next slide, and give the word back to Magda. Thanks a lot.
Thank you very much, Neil. I think it was really very important, and I'm really happy to see such a in-depth analysis of the importance of data science for the modeling. We have just a very short time for discussion, so maybe I would like to invite Vittoria and then Jaco to give their point of view about the usefulness and the challenges maybe about data in real-time modeling.
Yes, if I can add one point, is that really what we were able to do in this almost 2 years of pandemic benefited from about 10, 15 years of research into identifying this data, which kind of data were going to be useful for modeling, for response, and also setting up the frameworks. Many of the data sets that Neil mentioned really are based on previous work that pushed the availability and allowed also this data to be available in real time or to be created in real time. And so there was really a movement towards the importance of data already that made this possible in a crisis.
And Jaco?
Yes, in addition to that, I think that it's really important to set up the good data streams in peacetime, as Neil mentioned it. Like our experience has been that like integrating different data streams has been like much easier within systems that have been operating for a longer time. And during a crisis, it's sometimes very hard to get things moving. So I think just setting up a sound system for integrating the different data streams is essential. And you cannot do that only during a time of crisis.
Absolutely, that's a very good point. We have several questions on the chat, and I'm aware of this, but I'm afraid we will really need to move on because we are getting behind the schedule. So I think we might take it to some breakout, how it works in the virtual world. And with this, I would like to pass on to Bruno to introduce the next speaker.
Thank you, Magda. So it's time now for our third and last speaker, and Vittoria Colligia will now explain to us how modelers can use data to inform policy making. So as always, we encourage the audience to submit questions using the live chat box, and they will be addressed after Vittoria's presentation. And Vittoria, the floor is yours.
Thank you, Bruno. Thanks a lot to our organizer for this opportunity. I'm going forward to the slides. I was supposed to have slides on 3 questions that are going to be asked as a poll to all participants. I don't see the slides on my screen, so I would like to kindly ask the production to put on the slides on the 3 questions. They will be available. There will be a link also on the chat, and you will be able to answer to these questions about communicating and using modeling during crisis. and results will be discussed afterwards. So I'll start with my talk and I will follow after Jako's and Neil's talk, and mainly try to address the part on communication. And before going into that, let me of course thank on my side also the large team of collaborators who've been contributing to the work that we've been doing during this time of crisis. So I wanted to start from this aspect of what could we do in absence of data and models. And clearly epidemiology is a discipline that is based on data. And if we had to only base our understanding of the situation on, for example, previous experience, so we know that this is not possible for several different reasons. First of all, our world evolves so fast that maybe the last pandemic is not a good example to the pandemic we are currently living. Also, an emerging epidemic is typically different every time, and so we may not have in our recent past a good paradigm in order to understand from previous experience. And even if we just focus on COVID-19, we know what are the limits of comparing experiences across different countries. So think about the heterogeneity of the rise of cases that we're seeing now in Europe. And at the same time, this winter, for example, is very different from last winter. The other option that we can use is common sense. Now, the problem with common sense is that it often fails. As I see some sound in the background, so if I think somebody's not on mute, I'm sorry. Thank you. And there is common sense, which the problem with common sense is that it often fails our understanding of things. And a classic example is when we have dealing with nonlinear behaviors.
Continue the discussions.
I'm so sorry, but I have people speaking on the phone, and it's very hard to make a presentation in these conditions. So common sense fails us often, especially when we're dealing with nonlinear behaviors. And this is a classic example is the exponential growth bias, for which our brain are much more used to understanding a linear increase and much less to understand instead an exponential increase. And this is true also for mathematically skilled individuals. And indeed, if we see a curve of an exponential increase, what often happens is that people, the general public, the media, often also authorities understand that there is the exponential only in the last part of this curve, when the curve is increasing very fast, even though the doubling of the numbers occurs also when the numbers are low. This was a nightmare of communication during the first wave, and unfortunately, this continues to be a strong bias in our understanding. And we can use articles that are commenting, for example, the current situation in Europe as an example. Now, why is this important? Well, if we have a bias in our perception risk, whether we are individuals or whether we are, for example, decision makers, then of course we're not ready to act properly in terms of applying the correct prevention and control measures. So communication clearly was one of the biggest challenges during this time of crisis. And another aspect of communication that was a challenge was clearly timeliness. And here I'm using a specific example of the first wave in France. The plot on the left shows the admissions into hospitals in the Ile-de-France region, the region of Paris that was heavily hit by the pandemic. And you can see the rise of these cases. The vertical line indicates when the lockdown was implemented nationwide. And you can clearly see that by the time the last dots are shown on the plot, that is few weeks, about 3 weeks from the lockdown, it was clear from the data that the rise was stopped. But it was not yet clear that from this cloud of points, we were going then to have a decrease in the viral circulation, and so also in the number of hospital admissions. On the other hand, it was important to communicate something to the general public on the impact of this intervention. And given that we couldn't rely really on testing data, we had to use something else. So what we did was to use data from mobile phones. This was a long-time collaboration that we had with Orange company. And as Neil said, this was one of the biggest, let's say, novelty in our response to this pandemic. And so using the mobile phone data, we were able to estimate what was the reduction in mobility, and also estimate how many people were staying at home and what was the percentage of individuals still going to work. This would allow us to inform the age matrices that Neil and Jaakko was talking about, and then provide information to the authorities on the anticipating the descent of this curve. This was then done in a very, very short time, and in that case, timeliness was, of course, the biggest issue. But whenever you have this problem of achieving something as fast as possible and also as good as possible, there is a very big trade-off. And in that trade-off, the limitations of the approach becomes as important as the modeling results themselves. And these limitations need to be communicated clearly. And communication of limitation is really a difficult task. Of course, it's very clear for experts of modeling. It's less clear for people who are not familiar with mathematical models. And this can be done whenever you have a continuous dialogue between models and policy decisions that is not only made during the time of crisis, but it's also especially trained in peacetime. Another element that is extremely important is also the fact to have an intermediate body that typically this was played, at least in our case, by public health agencies, which have the expertise in order to understand this limitation, and at the same time, they have also the expertise to be able to communicate that in the right frame to policymakers so that these limitations are taken into account, and also these limitations are, and also what is our assessment of how this limitation may impact the results of model are well communicated. Another typical problem in communicating to authorities the results of models are the difference between forecast and projections. And here I'm using forecast. Of course, we're talking about model predictions for the future in this case, which have enticed authorities, general public, and media. And of course, they have a huge importance into navigating into uncharted territory. But here I'm using the term forecast exclusively for the predictions of the model that provide information of what will happen. These are typically done by fitting the model to all the available data and then providing these predictions for a very short time frame, 2-3 weeks. Here I'm showing the results for France and Italy provided by the forecast hub of ECDC. And these predictions are unconditional. In that sense, they're really forecast in the sense of the weather forecast. But on the other hand, they span a very short time. They are used in order to anticipate very short-term needs. For example, the number of beds that need to be allocated in a hospital in a given region. Now, the problems with these, with communicating this data is, on one side, is that authorities would like us to elongate this interval, not understanding that, of course, there is an intrinsic limitation for which we cannot really go further than that. Another aspect is, for example, whenever we have a situation that is stable over time, so R is almost equal to 1, which was the situation about the middle of October shown on the left for the case of France. In that case, your confidence interval is very large, and it means that even qualitatively, our forecasts are not able to say whether the curve will continue to be stable, whether it will increase or decrease. Another problem is also that, of course, these predictions are based on what we know up to now, but things can change, and so it's difficult in their interpretation. The plot, always on the forecast that is on the right, refer to Italy on the same situation. You can see that while predictions were continuing to go down in the curve of the number of cases, the actual data showed an increase. Now you have one data point only, so it's hard to say whether this observation in the data set is a fluctuation of the moment, whether this is due to a policy change. By the time Italy was implementing a health pass for all employees, forcing a lot of people to go and get tested in order to respect the new regulations. But it's also due to the fact that you have behaviors changing. And I think that the strongest limitation, of course, of forecast is that behavior will change. And so whenever there is a change point, forecast will not be able to capture that. Now, on the other side of what we're able to do in terms of model predictions for the future, we have projections. And projections are the model results that are fitted to data, but they are conditional to specified scenarios. And they can go ahead for several months, and their role is to anticipate on the long term the trends, the resources, in order to prepare also that maybe there is a wave coming, and so we need to prepare for that. Now, it's puzzling to say, but somehow these predictions, given that they're not forecasted, they will not provide what is going to happen, but what is expected to be happening given condition. Interpretation is always very hard. And it's puzzling in the sense that in our daily life, we have a continuous use of these scenarios. If we have to go from A to B, we know that the time that it will take us to do this path will strongly depend on the conditions that we're going to use, so on the means of transportation. And forgetting the means of transportation means that we're not able to interpret the results of these model projections, which are the timing. Of course, another aspect is that our model may, for example, predict that it will take more than 6 hours to go from A to B. But then along the road, we realized that this is just far too long. And so we decide and change the condition and we jump on the car. Now, is the model prediction then valid or not anymore? And one important aspect that clearly we knew from a previous pandemic, but this was clear, so strongly clear for COVID, is that communication itself impact behaviors. Imagine when, of course, there is the announcement of the use of a health pass. This pushed a lot of people to get vaccinated. But also the announcement of, for example, during the second lockdown, that we were going to exit from that lockdown before Christmas, pushed a lot of people to relax their adherence to mobility restrictions. And adaptation of behaviors can be even more subtle than that. For example, if you have a synchronous implementation of restrictions, the areas which are not under restriction may anyway readapt their behaviors given that restrictions have been implemented somewhere else. And these are probably the parts for which we have fewer data, and we know that these mechanisms are at play, but we still need to understand them. So if we go back to the validation, let's say, flowchart that both Jaakko and Neil talked about, I think that along this path of validation, we need to account also that clearly, our communication to authorities, if then policy decisions are taken, these will impact the epidemic, and this is, of course, the aim itself of the policy decisions. But also simply the communication of modeling results. Communication that can be done through the media or can be done also by the modelers themselves will affect the reality in that it will affect also will affect also the behavior of individuals. And this, I think, is really our next challenge. So thank you very much.
Thank you very much, Victoria. So I think that we have many replies from the poll, so maybe we can have the results on the screen, and I will let you comment. So can we get the results on the screen for the moderation too, please? Not so I can see. Okay, so yes. So Victoria, can you see the results?
I'm not able really to read properly. It's out of focus for me. Can somebody else read? Yeah, Bruno, you can go ahead, please.
Yes, so the first question was, have you used modeling data in your communication to policymakers? No, this is, okay, this one. Have you used modeling data in your communication to policymakers and the general public? And the answer is yes, in majority, but I can't see the number on my screen. So maybe, Adam, you can tell us.
Yes, so the 58% say yes and 42% no.
Okay, the second question was, has access to data on the effective collaboration with data providers been an issue? And if we can see the results. So this is encouraging, but I will let Adam give us the numbers.
So we're something like 69% say yes, and 70% yes and 30% no.
Okay, so there were some issues in data access, if we understand well the answer. I will let the panel comment later. And the last question was, has your experience of using models for communication been positive, mixed, or negative?
And there we have 70% say it's been a mixed experience, 25% positive, and 4% negative, 24% and 4%. Yeah.
Okay, so Victoria, the floor is yours, and I'm sure that you, Neil, and Jaco will comment on these results, or
yes.
maybe.
Absolutely. So I think I'm quite puzzled. I thought that there was an overwhelming larger use, for example, of models than what is resulting from the first question, about 60% to 40%. And I'm also surprised by the mixed modeling, mixed feeling. But I also understand it in light of a lot of misinterpretation, misconception, and miscommunication that have happened. And these are really the aspects, the challenges that we were trying to highlight in this with the last slides. Neil and Jaco, I'm sure you have your own thoughts about that.
Yeah, perhaps I can kick off. I thought it's kind of interesting to get this result from the poll. Like I think understand the mixed response to using modeling. I think like this is the first time that modeling of infectious diseases has been used to such a large extent, and I think it's like quite new to a lot of people. So it's very different from, say, weather forecasts and projections where everybody is used to these. So I think perhaps it's also something that everybody has to get used to. Over.
Let me just add to that I think it's particularly challenging to talk about modeling, to talk about different scenarios. A lot of people want to know the future, they want to predict. And I always say we're not predicting with models, we're doing scenario analyses. And of course, that's not reality as such. You have different behavior, and Victoria already mentioned it. I think compensatory behavior is one of these things that we do not understand well enough, I think. Of course, we have a lot of data now, so I hope in the future we'll have a better understanding, but nevertheless, there are always unexpected things to occur. And the second thing is this, translating uncertainty. People have a very hard time already interpreting risk in general. So if you then have a lot of uncertainty on top of that, it makes things really complicated to actually to convey the message you want to convey. And therefore, I think we need to increase scientific literacy with respect to modeling as such. But at the same time, I think what is also should not be done is putting the model at the heart of decision making as the only factor. It's a lot of different elements that come to the table. It's not only the model as such. And so it helps a lot to look at what are the possible directions to go to. But it's one of the components that we need to take into account. And we need a more holistic view on things.
Thank you very much, Neil. So maybe one question for you, Victoria, from the audience. There are many questions, so I will just pick one. During the COVID pandemic, some national authorities appear to have based a lot of their public health decision-making on the models that you are presenting. And there have been numerous events during this time when the reality of the local pandemic sharply contrasted with what the model was predicting. Yet decision-making continued to rely on the model. So how do you as individuals handle this conflict in evidence, reality versus the model? And how do you consolidate this as an advisor to decision-makers?
So we didn't have this particular example in France, so I cannot, let's say, pick it from my toolbox of experience. But we have an episode that, let's say, is close enough to what has been mentioned in the question. And again, the discrepancy, the challenge was a challenge of communication. So we're talking about beginning of January, and there is the new alpha variant that has been detected on the territory, and immediately, very early in the first half of January. And this was after also, of course, talking with our fellow collaborators across Europe. We identify the risk of a third wave. And the certainty, so across all possible scenarios, the certainty was that we were going to have a third wave unless we were going to put restrictions that were stronger compared to what we currently had at that time. We were having at that time, which was a curfew. Now, at that point, authorities decided to implement a more restrictive curfew, anticipating the time of curfew from 8 p.m. to 6 p.m. And then, of course, this gained time over the rise of the cases. We updated our models, and we continue to provide the information that despite this additional restriction, we were going to have a third wave due to the alpha variant. And also because while authorities were hoping to have vaccination mitigate this wave, we showed that vaccination was still very, very low, incredibly low. So even, in other words, had a negligible impact on the third wave. Now, this continued across several weeks, and this wave was not seen. The reason was because more restrictive intervention worked, but we mentioned that were not enough. And then also because we had interrupted periods due to school vacation, and these we know have a very good effect of slowing down the epidemic. And then by the beginning of March, it was clear that the wave was starting and was really taking off as we predicted early January. So I think that in that case, the possible misunderstanding is, again, the interpretation of the model results. The importance of our model projections were not exactly on when the epidemic wave was going to happen, because this will depend inevitably whether the authorities will implement additional restrictions, whether we have, for example, changes of behavior. But the wave was predicted to be strong enough to be anyway occur in the upcoming weeks, unless more restrictive measures like a lockdown was going to put in effect. And so I think that the contrast between predictions and let's say interventions, at least in our case, was this one. And by the way, in that situation, authorities didn't follow, let's say, the scenarios predicted by the model, and by the beginning of March, of course, they realized that there was a wave coming, and 2 weeks after, if part of France was put on lockdown, followed by the rest of the country, as was initially predicted.
Thank you, Victoria. So the session has been extended for 10 minutes, so I think we have time until 11:40 to discuss. So maybe Jaco and Neil, did you have similar experience with discrepancies between modeling and reality, and how did you deal with that?
Yes, I can briefly comment on it, but I think it will basically be an elaboration of what Victoria just mentioned. And I think I would like just to highlight one of the slides that Victoria presented about the difference between a projection and a forecast. And I think also what Neil mentioned, I think a lot of people perceive that like most model outcomes are predictions, and that when something else happens, it's that the model is wrong. And I think very often, like the model outcomes that at least that we use are kind of projections that will never be realized. And I think the real problem is how to communicate that to the general public. So I think a perception is very easily generated that models are very often wrong. Well, I think that in a kind of decision-making process, they've been very useful at the same time. And I think that's just a difficult message to get across. I think that that a model is not good at predicting, but very useful in informing decisions. So that's a bit our experience over.
Thank you. Neil, would you like to comment?
Just maybe to add to that is indeed there have been quite a few discussions where people say the models were wrong, or this was not taken into account in the models and so on. If we look back at it, and that's what we do, validation-wise and so on, we have learned a lot, and therefore the model performance actually also improved. But at the same time, we need to think about what we're doing here. We're trying to predict behavior, and predicting behavior is really complicated. It's the driver of this pandemic as such. So, well, and I don't know that much about predicting behavior as such. I think what we always try to do is what if scenarios based on data that we get, and in hindsight, something else happened. And at least for Belgium, we have been able to explain what happened in quite a great detail. So I think in that sense, we're learning. But of course, we only learn also after some events occurred. So taking a model as a strategy in its own right, you need to take this into account. That it's sometimes the unpredictable that is truly happening, and that you have a lot of uncertainty again to deal with in terms of how people behave and how they react to certain items. Think about vaccination, for instance, or whether vaccinated people behave differently as unvaccinated people and so on, and what that really means in terms of modeling. Thank you.
Thank you, Neil. So maybe before the conclusion, I will give the floor back to Magda and Adam, and maybe we can pick some questions that we have to the previous speakers. Adam or Magda?
Thank you, Bruno. Yes, in fact, as we have more time now, I picked up some important questions from the audience regarding the data. And okay, we are going to phase out from this emergency stage at some point. And we probably will have the decision to make how to develop our data collection systems in the future. And there are new digital technologies coming as well. And the question that I picked up is whether it's better to have more data from different systems coming in, the broad range of data, or whether you would prefer, as modelers, to have specific focus studies to interpret the assumptions or to help you with assumptions, or would you? How would you comment on that? What is more valuable?
Maybe Neil first.
Sure, happy to take this one. At least to me, both are, of course, if you have to choose, you have to choose, but I don't think we have to choose really. We have to design good surveillance systems, which we know very well, but at the same time, relying on one source or a few sources only actually, that prohibits a kind of a broad view on what is happening sometimes, because each data source in its own right has issues. Each surveillance system has its own issues. So I think it's really about getting all these data together, but the design of these data streams and how data are collected should actually be improved so that we can do a better job at bringing these good data together rather than data that is prone to many biases, for instance.
So I've also picked up a question that's come in a few different ways, but to any of you or to all of the speakers, is there anything you wish that you knew before all of this started? Not specific to COVID, but more about knowledge of methods or ways to respond to a pandemic or so. Is there a knowledge you would have liked to have had before that you've now gained?
Yes, for me, and it's still about behavior and how far we can go in the response. We have put in place unprecedented responses that we never thought imaginable. Complete travel shutdowns, border closure, lockdowns. These were never in our papers before because we always thought about feasible interventions. And there is specifically a whole literature that lasted about 10 years on travel restrictions. And we always mention feasible travel restrictions because we thought going beyond even 50% of travel reductions would not be possible. And now reality showed us that we had complete travel ban, and we pushed really our responses because of the need. We pushed it to the limits that were unthinkable before. And in that sense, I think we need to reorganize also our thinking into what kind of interventions are feasibly possible if there is a novel emergency like this one, when there will be.
Thank you. Jack or Neil, do you have any such thoughts?
Well, perhaps in addition to that, I think it's like what I've learned is that like you can never expect what's coming. So I think it's very important to be very open and flexible. I think there's a little bit in danger, like if I now mention what I would have liked to know about the COVID pandemic, but I think the crucial thing is that, like in whatever pandemic you are, there will be, or whatever new disease you deal with, there will be completely unexpected things happening. And I think you have to be very open to that. And I think that is really a challenge because there's a huge tendency to prepare for the last emergency and not for the future. Over. Thank you.
And Neil?
Yeah, well, there are a few things that cross my mind at this moment. I think we learned a lot during this pandemic. I hope we take it forward and basically, in terms of pandemic preparedness, we take the important elements with us. One thing that strikes me most, and I think is truly really important, is the mental health side of things, because we've been discussing this a lot over and over again. But honestly, at some points, we did not have any zero measurements before this pandemic either. So you're actually, you don't know very well what is the stage where we were in before and how has this evolved and what is the resilience in people, basically. I think that's one of the key things that I would like to understand better, because it's not only an epidemiological crisis, of course, it's much broader than that. And I think I don't think we underestimated it, but I think we lacked specifically good data about it to deal with it in a much better way.
Thank you very much.
Yeah, I just would like to ask a question to Neil because he was telling us that we need good surveillance system, and I am much more on the surveillance side than the modeling side. So I'm very interested in listening to you. What is a good surveillance system or modeler?
Yeah, that's a very good question. And I think it's not resolved as such because a good surveillance system should be sustainable. And that will also have its logistic needs, let's say. But what I see, and we've been fairly fast in setting up surveillance systems on incidence data, for instance. But then it was not always clear which case definitions were used, but they were not consistent over different countries, for instance. The other bit is hospitalization data, and I think we can improve on that. At least in Belgium, we've seen progress, but I think we still need to improve on this. It's not priority number one for a hospital, of course, but it's one of these key parameters that can actually make life easier when you have this from a management point of view. It's certainly in a pandemic, but also I think in non-pandemic times as well. And then serosurveillance. Serosurveillance is something that I've been putting on my agenda for many years already. We can learn a lot from serological data. It's not the holy grail as all the things that we're doing. But it's one big. It's a really an important picture that we can have for this pandemic, but also for other pandemics. And at conducting serological surveys at regular time points in different countries, we can learn a lot of how different diseases transmit, and we can be ready for the next threat basically before it occurs, because you can identify gaps of susceptibility, for instance, and so on. So I think getting all of that together and think about also genomic surveillance as one of them that has been picked up quite a bit now in this pandemic, but it was underdeveloped before, I think. And of course, all these things cost money. A lot of budget would go to it, but at the same time, we see how much money we're actually spending nowadays on managing this crisis. I think the return of investment is clear, at least to me. It's clear, and talking to economists, it's also clear to them.
Thank you very much. Adam and Magda, is it time maybe for the conclusion?
I think so. I mean, there are several questions more, but I can encourage, if there are specifically pointed questions to our speakers, you can go into the chat and answer some of those. And otherwise, there is also a possibility for this chat will continue to be open. So that's good. So I agree with you, Bruno. Let's go to the conclusions.
Okay, so maybe we have to summarize and give some take-home messages for the audience and our panelists. So I don't know how you want to proceed. Maybe we start with Magda and Adam, and I will add my piece of advice. I picked a few lines from the speaker, so I'm ready, but it's up to you. Magda, do you want to?
Yes, sure. Sure, Bruno. Thank you very much. Yes, from this discussion, I think a take-home message for me is that it is really necessary and key to develop collaboration and different systems for also data collection. And it needs to be done in the peacetime, preferably, because it's quite difficult to manage it in the emergency situations. And the successful modeling teams actually did have those collaborations ongoing before the COVID pandemic, and that resulted in availability of data and also possibility to validate the models and better use them for communication. So that is one of my take-home messages, is definitely that we need to invest that in the peace times.
Yeah, my take-home message would be that models is not so much about predicting, but to inform decisions, and that therefore communicating limitations, that it's just part of the decision making and not the full piece of information in itself. I think that's a really important message to take home that I got out. Over.
Thank you. And I also have a take-home message. I think that the open science and openness of data sets and methodology also are an important issue. And also the timeliness. And I remember the line from Vittoria, who said that an 80% right paper before a policy decision is worth 95% right papers afterwards, provided the methodological limitations are made clear. So I think that this is the importance of timeliness and the difficulty of field epidemiology, and I will say field modeling maybe, that we have to get the proper results, but timely. So I think this is one of the key message I would like to remember. Or maybe we can have Vittoria, Jaco, and Neil a few words just to conclude the session. Vittoria, last word.
Yes, I think we clearly have ahead of us a few challenges, which are on the methodological aspect, which are on the infrastructures, on the data we need to collect. But more specifically, I think we really need to improve also our communications. Never before this has been so crucial and important, not only to authorities, but also to the general public.
Thank you. Jaco?
Well, I have to second that. I think communicating modeling results is like very, very important, and I think there's much to be learned on how to do that properly. And I think that ties then into I think Adam's take-home message, that I think like what is actually the most valuable thing that models do, and I think it's informing rather than presenting predictions, just informing decisions. Over.
Thank you. Neil?
Whereas I think models are really, really helpful. I think at times we also should be quite modest in what they can do and can't do. So in that sense, I think, and of course I second the previous speakers' answers and comments, but I think we really should be a bit modest about what models can do, but at the same time also, take them with us, because they are useful. They give a little bit of a heads up on what is possible in the near future.
Thank you very much. So I will give the floor back to Adam, our host at ECDC. And Adam, the last word will be for you, and thank you for organizing this session.
Thank you, Bruno and Magda, for all of this, for the support, and thank you so much to our three speakers, and also to the audience who have come up with so many great questions. And please continue the discussions either in the chat or in the room of reflections, and of course in work life in general. So thank you all for this great session and for coming.
Thank you.
Thank you. Bye-bye.
Thank you.